He started practicing 5 years before our association was formed. He is that much familiar in Houston. He is a USA speaker. USA speaker. He is a writer. He is an auctioneer, MC, photographer, and a community ambassador. He has NNN media, where he has 16,000 contacts, and he is on YouTube. It has more than 1,200 videos. So you guys can look up NNN and you'll find a lot of stuff from. I'd like to have him take this chair and present you guys with high blood pressure amongst Indians especially, and what are the remedies. He's going to talk about it for the rest of the time. Thank you so much.
Check. Can you all hear me? Okay, that's wonderful. The best part of my presentation you already heard from Modi. So from here onwards it's going to be just downhill. But what is more interesting is looking at all of you. I have not come here to preach anything, but to learn from you as to what is the secret of your smiley, successful lives. So, I just give you a brief introduction of what high blood pressure is, and then we're going to open up for question and answers so that it will be more useful for me to answer your questions concerning blood pressure, medications, complications, things like that, than for me to say something which is totally irrelevant to your personal lives. More than 60 million people in this country have blood pressure, and more than half of them don't even know they have high blood pressure. Blood pressure, for the most part, is silent, which is one of the reasons why most people don't know they have high blood pressure, and even if they have high blood pressure, they say they can beat it. I mean, let's face it, we are all people, you know, we like to, like Las Vegas, we like to play the horse. It's not going to hit me, so what the heck. So that's the important statistical aspect of this. Even those people who have high blood pressure and who would like to religiously control their blood pressure, sadly enough, less than half of these people's blood pressures are controlled. Even with the most modern medications we have today, and seeing the best specialists, which many of them are your own children, you still don't have your blood pressure under control. What does that tell you? So why is it that the blood pressure is such a major issue? If you look at the complications related to blood pressure, that should very much shake the very core of your life, because one of the major complications of blood pressure is stroke. As far as I'm concerned, when someone gets a stroke, that's the sunset of their life, for the most part. Especially if it's a bad stroke where you can't move, that's even worse. But the good part is, by controlling blood pressure, we can reduce the risk of a stroke by 60%, which is one of the most phenomenal things as far as blood pressure control is concerned. Keeping that in mind, that by just taking a few pills a day, that you can reduce the risk of stroke by 60%, how many of you would be willing to take the medications versus a stroke? Okay. Huh? Everybody. Okay, that's good. That's the first and most important thing, is for us to take our blood pressure pills on a regular basis. The second and another important point we would like to focus is we need to monitor blood pressure. How many of you monitor the blood pressure? Can I see a show of hands, please? Only about a third of you. At your age, or I should say at my age, all of us should be monitoring blood pressure. Because blood pressure is not a static number. Blood pressure varies from morning to afternoon to evening. And sometimes your blood pressure may be very high, and sometimes your blood pressure may be low. A lot of people have very high blood pressures in the early morning hours, which is when most people get heart attacks. So, if your blood pressure is fluctuating over a period of several hours during the course of a day, you have what is called the labile hypertension or a fleeting hypertension. That needs treatment as much as a patient with a blood pressure of 180 over 110. So that's another important point you can take home. Some of the doctor's offices have what is called the blood pressure monitoring machine, which can record your blood pressure for 24 hours. Then you may want to wear those monitors and see if your blood pressure is widely fluctuating during the course of a day. A lot of people wake up with 120 over 80. By 11 o'clock, their blood pressure may be like 180 over 110, something like that. That is hypertension. So it's important to make sure that you take record of your blood pressure and discuss with your primary doctor or specialist and see what kind of treatment you need for blood pressure. Over 95% of the people who have blood pressure, there is actually no underlying cause for the blood pressure, which is kind of good because you don't want to have a kidney tumor and have blood pressure. So if you have what is called the essential hypertension, which is where we do not have any obvious cause, that's fine. You know, you have it, but the important thing is you got to take treatment. And the best way is to take medications. You can reduce salt intake in your diet. Weight reduction automatically brings down the blood pressure and also reduces the need for more medications. And if you engage in activities, that also brings down the blood pressure. So let's look at some of the things we can do in terms of how we can bring the blood pressure down. But before I do that, I would like to talk about what is normal blood pressure. What number should we be aiming for? Because these numbers keep changing depending on the fancy of the researchers. Because until a couple of months ago, they said for people over age 60, the blood pressure lower limit of blood pressure is 140 over 90 to 95. The American College of Cardiology came out last month and said, well, that number is too high. Their blood pressure should be between 120 over 74, not 140 over 90 to 95. There's a big difference between 140 over 90 and 124 over 78 or 80 millimeters of mercury. Because if you're talking about people who are 65 years or older, that blood pressure may not be achievable because we have what is called as the stiffening of the arteries, which keeps our blood pressure higher. And it is hard to bring the blood pressure down. No, yes, as a cardiologist, I can bring it down. But when you bring the blood pressure drastically down to 120 over 70 or 100 or 110 over 60, people are going to develop symptoms. Dizziness, weakness, fatigue, and kidney problems. So it is important to understand how we balance our blood pressure based on our age and also other risk factors like diabetes. Yes, if somebody has diabetes, you need to keep that blood pressure to a tune of 130 over 85 millimeters of mercury. But at the same time, you have to keep track of the fact if it's a 70-year-old person who has what is called systolic hypertension or just elevated high top number, you don't want to force and bring their blood pressure down, because every time you bring their blood pressure down, they're going to feel dizzy, they're going to feel weak, and they may even pass out. So we have to sort of balance, and blood pressure is not a cookie cutter treatment for all of you in this room. Everyone has to be individually evaluated and started on treatment for blood pressure. There are a whole bunch of medications available for blood pressure in terms of controlling the blood pressure, and I can guarantee you all of them have problems or side effects. So there's not a single medicine that does not have side effects. However, the selection of medication for treatment of hypertension is not just based on one arbitrary number or a bunch of readings, as most primary doctors or other physicians may think. But as a specialist and as a cardiologist, to me, it is the overall composition of the patient's physical health, weight, presence of diabetes, kidney problem, heart failure. All of these take into account as to what particular drug we use for controlling blood pressure. One of the most frequently used drugs for control of hypertension is known as the ACE inhibitors. And ACE inhibitors basically bring down the resistance in the blood vessels. They dilate the blood vessels, make the blood vessels more flexible. As a result, the blood pressure comes down. And ACE inhibitors are like lisinopril, enalapril, monopril, all this group of drugs. However, these ACE inhibitors have a problem. They produce bradykinin, which sort of irritates the airways, that leads to coughing. That's one of the reasons a lot of people stop taking these enalapril, Receptor, monopril, drugs in those categories. In order to overcome this cough, we came up with a second group of little improvised drug known as the ARBs, or Angiotensin receptor blockers, the most common of which are losartan or Diovan or irbesartan, things like these. They do not cause cough, but nonetheless, they do control the blood pressure. So we have these two drugs, the ACE inhibitors, then we have the ARBs, which should be the first line of drugs in treating patients with hypertension. The good thing is people with normal kidney function or people who have diabetes, these ACE inhibitors or ARBs also have what is called renal protective mechanism. That means they protect the kidneys from going into failure. They may just postpone before someone develops the kidney failure, but it has the renal protective effect. However, if the patient already has a kidney failure, then we have to carefully titrate these drugs so that we do not worsen the kidney problem. The second group of drugs we have are known as the beta blockers. Most of you are familiar with. It could be metoprolol, or it could be Inderol, atenolol, or a whole bunch of other drugs. Beta blockers reduce the function of the heart pumping effect. They reduce the heart rate, and by these numbers, by these characteristics, sometimes beta blockers may not be the first line of drug in patients with severe heart failure, or if somebody has a real slow heart rate. That's why I said we have to tailor each medication we use in patients with hypertension based on all the pre-existing conditions like heart failure, heart rhythm, kidney problems, diabetes, fluid problems. All these things have to be taken into consideration, which makes it more complex. So the beta blockers do work in patients with hypertension. They do, to a small extent, reduce the effect of heart attacks, and they are pretty well tolerated. A lot of people have been on this for 20, 30, 40 years. When you start taking more than 2 or 3 different types of medications, all these medicines retain salt. As a result, you may start developing swelling in your legs, increase in your weight, and fluid retention. When this happens, we may add a third type of drug known as the diuretic. A lot of times we use a milder diuretic known as the hydrochlorothiazide, which is the most commonly used drug. But when it doesn't do the job adequately, we use Lasix or furosemide, which is the most commonly used diuretic. There are other ones, but they are all used in more complex patients. So we talked about the ACE inhibitors and the ARBs, which belong to one class of drugs. We talked about the beta blockers. We talked about the diuretics. There's another class of drugs which are used for controlling hypertension. Those are the calcium channel blockers. 20 years ago, we used to have Rabimel, which acted just like beta blockers by reducing the heart contractility and reducing the heart rate and bringing the blood pressure down. Then we have Cardiology, which has been used for a long time, but now it's mainly used for treating patients with rapid heartbeats. Then we also had Procardia. The Procardia was initially found to be a wonderful drug in controlling blood pressure. Then later on we found out it may precipitate heart attack in patients with underlying heart disease. So Procardia is no longer used. The only calcium channel blocker that is regularly used in patients for control of hypertension is known as amlodipine or Norvasc, Norvasc, 5 to 10 milligrams. And usually a combination of these drugs should be able to control your blood pressure. There are other lesser used drugs known as alpha blockers like doxycycline or Hytrin, which are used for prostate enlargement. These alpha blockers also do bring the blood pressure down. So that's an important point. If you are having enlarged prostate and if you are already taking these medications for enlarged prostate, you need to let your doctor know, because when they add other medications for blood pressure, then it may precipitously drop your blood pressure. So that's why I say treatment of hypertension may seem very simple, but everything has to be taken into context before we write the medication, because every time we write a medication, especially somebody who has already been on 5 or 6 medications, I will guarantee you they're going to have side effects. And sometimes the side effects could be worse than the medication used for controlling high blood pressure itself. So this is in a real brief overview of control of hypertension. The benefits of controlling hypertension, one of the biggest benefits of controlling hypertension is reduction of a stroke by almost 60%. And it also prevents people from going into kidney failure for a long period of time than if you were to walk in with uncontrolled blood pressure. The worst possible complication is, of course, intracranial bleeding leading to major stroke or a coma. So that's a brief overview, but I would like to open up for question and answers, because that's where we really learn something about what is bothering you and why your medications are not working, and how we can brainstorm and see what we can learn from each other. Okay, who wants to be first? Yes, please. If your blood pressure is fairly steady, you can check it like once or twice a day. But if you are having problem with your medications, if your medications are not working, then you may want to check it 3-4 times a day to see how the medicine is working. I had people, who would come up with 4 different readings at 4 different times of the day. That will help me to see how I adjust the medicine and which medicines you take in the morning, which medicines you take in the evening. Also, if we have a severely elevated blood pressure, it is my personal experience that you have to take most of these medications twice a day. Even though the prescription says you can take it once a day, my personal experience is it helps to take half dose twice a day, so you get a much smoother level of the medication and lesser side effects, so that the main aim in controlling blood pressure is to maintain a steady level of blood pressure if you can possibly. 12 hours apart, most of the medications. Oh, the measuring, I would say check one at 7 o'clock, 11 o'clock, 3 o'clock and 9 o'clock before you go to sleep. It tells us which medications are working, which medication effect is tapering off by the end of the day. Then that helps us to see if we need to add medications in the evening to keep your blood pressure much lower during the evening and night hours. Question, yes please.
Which is the best time to take the medicine?
It all depends on our routine, and you can take it right after breakfast at 8 o'clock, and again the second dose if you are take 12 hours apart, so we have a steady level. So that's the main thing. The main purpose is to keep your blood pressure steady throughout the 24-hour period. Yes, please.
Our connection with the blood pressure. I give you my example. The doctor was giving 25 antidepressants and 50
Yeah.
When I was taking 50 mg at a time, the blood pressure was coming down. In this case, what is the effect of the power?
I think, as I said, we have to titrate it very, very smoothly over a period of weeks. And if 25 milligrams was less, if 50 milligrams was too much, then we have to find maybe somewhere in between, or maybe instead of 25 milligrams extra dose, you may want to add a small dose of beta blocker in the evening. That might help to control the blood pressure without dropping it too much. Because there are some medicines that are stronger than others. These inhibitors are fairly powerful in bringing the blood pressure down. So you may want to take 25 in the morning and maybe look at a small dose of beta blocker in the evening if the blood pressure is going up in the evening. That's why monitoring blood pressure 4 times a day tells us when your blood pressure is spiking back up again.
My question is the higher power will affect what is the side effect? 25 or 50 mg, the higher power.
It all depends on individual patients. We have patients who take 200 milligrams of losartan. So the dose is what it takes to control your blood pressure without major side effects. Yes, please.
Blood pressure numbers end up higher.
Yes, as we grow older, every decade the number goes up by 10 points. So if you are 70 years old, 140 over 90 is not the blood pressure target. It could be 160 over 80 or something. But now the American College is trying to push it to 124, which I don't agree, because when you push that blood pressure to that level, people are going to feel dizzy, weak and tired. Yes, please.
My systolic blood pressure is always high. So I take medicines.
Okay, you're on an A or B, amlodipine, metformin, and okay, let me talk about this. As we get older, in the 70s and 80s, a lot of times, as I mentioned earlier, our blood vessels, instead of being very flexible tube, like a balloon, flexible tube, they become real stiff. Some of them like pipes. So these blood vessels don't dilate. As a result, the blood pressure, I had people with 220 over 80 millimeters of mercury. There is no way we can try to bring it down to 160 or 70, because the bottom number is going to go down to 30 or 40. They're going to start feeling dizzy, they're going to feel weak. In those situations, what we do is add a beta blocker to see if we can bring it down to a reasonable level. I had one lady whose blood pressure, we could never bring it down below 200. But she was fine, she was walking around, she had no problem. So as I said, we have to look at each individual patient and see what is the optimal level we can achieve given the medications and the side effects. Side effects are very important when we are talking about especially older patients who are already on 10 different other medications. Okay, yes please. I think let everybody get a chance. Yeah.
Those members who want to go to picnic on 11th February, we're gonna start writing the names so you guys can stand in line for it.
Oh, okay, yes please.
गयो कचरो प्रोग्रामનો कचरो ગયો પ્રોગ્રામનો કચરો જાહેરાત કરે ભારત પાસ કોનો નામ હા તમે આવો કિચન કિચન
Yeah. Again, Nick, we have to look at the whole picture as to, the heart rate does go up. But people who are in their 60s and 70s, the chances of heart rate going up beyond 140 or 150 should be a concern, because that's really past the 100% maximum rate for a given age. So I would look at the whole picture and see, and sometimes maybe you are pushing beyond the limit as far as the exercise is concerned. You may want to exercise at a lesser intensity for a longer duration rather than just increasing the speed. Yeah.
I don't go beyond that. And still and it remains within the range. If we go to 50,
The heart rate doesn't jump like that. I would look at the monitor, because the monitors sometimes pick up artifacts from the movement and it may reflect as a change in heart rate. So the best way to monitor is by electrocardiogram.
I compare the audio with the monitor.
Yeah, I have to look at the whole thing to assess as to what's going on. Yes, please. Yeah.
Always systolic is always around 80 or sorry, systolic is always 80 or systolic is around 125, 130.
Yeah, go ahead.
In the afternoon, occasionally and usually it is around 135 to 140.
Yeah, 130 is not really high. Again, as I said, we have to take into account diabetes, kidney problem, and heart failure, and all these things in order to assess exactly what number is right for you. Yes, please. Sure. 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 Okay, a couple of things. One, losing weight definitely reduces blood pressure and also reduces the need for multiple medications. Number two, it has been shown by doing meditation, we can bring down the heart rate and blood pressure. So when you are doing all the good things, and when you are reducing the salt intake, when you reduce your weight, all these things positively work. On top of that, if pranayam is sort of a meditation, I think it's all the more good. The way I look at it is, if anything works for you without spending money, then it may be the best choice. Question this side. Yes, please, yes. Enalapril, Vasotenc, lisinopril, monopril, these are all the ACE inhibitors. Yes. Anybody else? Yes, please.
As general pharmacist,
Yes.
one of the issues I face amongst our people and others from who are not born is faith in informal medicine
Yes.
under different names.
That's
As a physician, to share some experience, because when people take the OTC in factories and
yes.
all the rest. In fact, I'm not a WhatsApp person. I just signed up. The first thing I received was, if I eat dudhi the way they want me to,
Yeah.
if I had any ailments, they'll all be cured. Do you face that kind of thing?
Well, I think all the way from shark cartilage to all kinds of over-the-counter stuff, they claim to be effective, and I have no personal knowledge of these medications because I never prescribed them, and I have never followed patients who are taking this to see what effect it had on their blood pressure. But if they are taking it and they claim it's working, they have to have substantiation with the recordings and see. But an important thing here we have to understand, a lot of it has psychological element. Because one, you are concerned about your blood pressure. Two, you are trying to control it naturally. And when you're doing these things, you're probably doing a lot of other things also, like reducing the salt, maybe reducing the weight, and all these can have a composite effect of giving you a sense of, like people are like, I was overweight and 6-7 pounds after all these holidays. When I got on the scale, I said, oh, I don't want to say the word. So I've been eating salad for 5 days. I lost 2-3 pounds, most of which is water. But at least it makes me feel better. So it has some psychological effect, and that could be helping. But in the long run, I think the main purpose is to reduce the complications. Kidney failure, stroke, hemorrhage, like that. Yes, please. Well, I think, again, when it comes to water, it's nice to have a lot of water, like 8 glasses of water and all this. But also we have to take that into context if you are able to eliminate that water. If your kidney function is borderline and you cannot eliminate the water, that can lead to fluid retention, worsening of heart failure symptoms, and a whole thing. It looks like I'm not a very good doctor giving you right answers. Because it is very complicated. If you have heart failure, you want to restrict fluid to no more than a liter a day. If you have kidney failure, you need to restrict your fluid intake. And we don't know, just we may have mild kidney failure, and that's why we end up taking water pills. So if you're drinking 8 glasses of water and water pills, they just don't go together. So when we drink water, if your kidney function is normal, heart function is normal, it probably works. But the moment you get into heart failure, kidney failure, or any other problems, then your doctor has to sort of determine how much water you should be able to get. Yes, please, there. Yes.
I have a question. I take 2 medications.
Yes.
So and I have a lot of muscle pain.
Okay, losartan and metoprolol. Okay. As I said, anytime we take strong doses of 2 or more medications, there is a tendency for body to retain salt, because we just simply dilate these blood vessels when we do this oozing of salt, and sometimes we may have to add a small dose of a diuretic. Usually we start off with the hydrochlorothiazide, 25 milligrams, something like that. If that doesn't work, then we have to take Lasix. But fluid retention with visible swelling in the legs could be an indication of many problems. It could be an indication of heart failure, kidney failure, venous insufficiency, or DVT. So there are a lot of things we need to look into before we can just say, I just have fluid retention from blood pressure. So, okay, yes, sir.
Has there noticed any difference in the effectiveness of brand name versus generic medicine versus getting medicine from India?
I think that's a very good question, and this can only be individually answered as to if you monitor your blood pressure and you see the generic medications are working, because over 90% of the medicines available for hypertension are generic now. If you go to Walmart or Sam's or Kroger or anything, they are giving you generic medications, which is $10 versus $140 for it.
What about the function?
Well, as I said, you need to monitor your blood pressure. If it's bringing it down, chances are likely it's working. If it doesn't work, maybe you switch to the pharmacy and see if a different brand might work. But it does make sense. Nobody can afford. For example, this cholesterol medicine is like $240. If you get a GoodRx coupon, it is $20. We live in an insane society. I'm serious, because if you take a 20 milligram Lipitor, it's $240, and you get a GoodRx coupon, which you can get it on your smartphone, the price comes to $20. I said, what the heck is this? Yes, you can. Oh, that's one thing, you all can sign up with GoodRx. Any medications you are taking which is not covered, you can get almost 80% discount on that. Yes, please. Yes.
Sometimes it's an issue of coordination between the specialists. Like I was taking metformin and Actos, and I was feeling shortness of breath. I lost my CBC count. Instead of being in the higher 10s, it was like 9, barely above 8. I kept talking to my endocrinologist, what's going on? We need to change the meds.
Yes.
If I went to my cardiologist like you, they would say, well, everything looks normal. Doesn't seem like you're having problems. I go back to the same guy, my my endocrinologist, and he said, I think you can't talk to me about this, you need to talk to your cardiologist. I was shuttled between the two for a long time until I went to my primary physician and told her to change Actos into Invocaine. I told the same thing to the doctor, that you need to do that. And he said, no, you don't need that. Your numbers look good. Doctors sometimes look at the numbers and not what the patient is talking about. And I'm a classic example of that, because every time I say something, I think this doesn't seem right. I say, no, your numbers look fine. Comes from the lab report, nothing is wrong with you. Continue with what your medicines are. And that's it. You are a cardiologist, he is an endocrinologist. This is a GI guy. Coordination of the patients, all different things, just doesn't exist in medicine.
Yeah, unfortunately, we have communication problem with our colleagues, which is nothing new. But at the same time, I think each specialist need to look at the entire list of medications and see what kind of side effects they have on the system they are treating. Like if we are treating hypertension and you go to an endocrinologist and they say your diabetes medicine is causing, you need to look at and see what side effects they have, because some of the medications given for a different condition may increase salt retention, fluid retention, and that can increase the blood pressure. And that's where the specialists need to know the side effects of other medications, or at least make an attempt to read the product insert and see, if there's something that's affecting this. And if they don't, Just fire the cardiologist, get a new one. I'm listed in the phone. Yes, sir. I'm sorry, got a little noise going on here. Go ahead. Yes. Yes. Yes, yes. All drugs have side effects, and beta blockers can cause some amount of bronchospasm, and that can lead to shortness of breath. It depends on what dose of metoprolol you are taking. It also depends on what your overall lung condition is. If you got like a COPD or something like that, that can have more profound effect. So this is like a delicate balance. Instead of metoprolol, maybe they can use Coreg or carvedilol, which may not have that bronchospasm effect that you see with metoprolol. So your specialists, like she said, the lung doctor and your cardiologist have to coordinate and decide what is the drug that best suits your situation. Let's give a chance to everybody so that who has not asked questions. Yes, sir, at the end. Oh, okay. Carvedilol is mostly used for patients with heart failure. It's supposed to improve survival and also improve symptoms. That's the main indications for using carvedilol. Carvedilol is not the best drug for controlling moderate to high blood pressure. So that's where it is used. Yes, please. Gallbladder? Gallbladder doesn't have, unless if your bladder is full and you can't pee, it can increase the blood pressure because of acute pain and stress. By the same token, if you are having problem urination, it may be prostate, and if for prostate, if they are giving you like Hytrin or Tomsolin or something like that, these are alpha blockers which also bring down the blood pressure. So if you're taking blood pressure medications already, you go to a urologist and he gives you more medications for the prostate, you have to tell him, oh, well, I have high blood pressure, I'm already on 3 medicines. So they may have to adjust the dosage of other medications in order to get you the medicine for enlarged prostate. Okay, this side is awfully quiet, so maybe said, let this man worry about all this blood pressure. Yes, sir. They don't follow the instructions anyway. Well, it depends on how high your blood pressure is and if the lisinopril is doing the work. What is the worst thing that can happen if you don't take your blood pressure pills? There is a risk of stroke, kidney failure, or hemorrhage. So I would stop anything. So I would try to keep the blood pressure like below 140/80, if at all possible. Okay, any other questions? Yes, please. Yes. Well, blood pressure is a lifelong problem, and so what I would say is just take the blood pressure and keep it low and enjoy the life. Bingo, bongra, or whatever it is. Just enjoy the life. I wouldn't count the pills as enemies, because as long as I can take the pill and I can function, I'll just keep on going. One more question, because I think everybody is waiting for lunch. Yes.
There's a little bit about
Not really. When you're getting the wine, just call me. Yes. That's suggesting the elevated blood sugar level, that may be an indication of pre-diabetes or a diabetes. Okay, thank you so much, and I'll be glad to answer any questions. Let everybody get their lunch, and then I'll be here. I'll be glad to answer any questions. Thank you so much.
We need your card.